Good morning. Thank you for being with us today with our panel of professionals speaking on various types of headaches and causes of headaches and how to treat them. My name is Brittany Sanchez. I am the owner and physical therapist at Velocity Physical Therapy with locations in both Hudson and New Richmond. So today I'm going to be talking about two different types of headaches, tension type headaches and cervicogenic headaches. So a tension type headache is caused by stress. Usually you feel it on both sides of your head. It's dull and it's achy. A cervicogenic headache, however, is caused by a dysfunction in the neck with nerve, disc, or spine, and is usually unilateral in pain on one side of the head. So how do we treat headaches, both types, in physical therapy? But first of all, what is a physical therapist? Who are physical therapists? Physical therapists are professionals that address the function of the body, which includes strength, range of motion, mobility, and just general function. We do that by incorporating different stretches, different strengthening techniques. We use our hands to do mobility and muscle techniques that help to reduce tension and mobility in the spine and things like that. Some modalities that you can use for headaches on the neck would be ice. You can apply heat. We do things like electrical stimulation on the muscles of the lower neck to help reduce tension. And we also you can also use things like essential oils or things like that that help with the olfactory nerves, meaning how you smell, and that helps with reduction of headaches as well. So one of the things that we do are stretches. So in the neck, there are various muscles. There are long muscles, short muscles, thick, thin. They all serve a purpose, and some of them can get more stressed than others. So when we stretch a muscle, it elongates the fibers and helps reduce pull on the bone or the structure that they're connected to. So there are specific sets of exercises that we give our patients to reduce tension and to reduce that pull of that specific muscle. It also resets the set point of the length of the muscle. So in our brains, our brain decides what length that muscle is going to be, and it sets it at that set point. Sometimes that set point can become off and it's shorter than it needs to be, so our muscles are always tense. So we do some brain retraining to help reset that point and elongate that muscle naturally and over a long period of time. It also reduces tension and stress to the ligaments and the tendons around those muscles to help also reduce that tension and that pain that is associated with it. Some examples of stretching would be hanging upside down. So we can do that with a table, or the one that I like to teach in clinic is the triangle pose. You put your feet really wide and then you hang your body down between your knees, and your head just has this natural gravity pulling it down, and it stretches the back of your neck and has that kind of traction feeling on the neck itself. So that is super helpful when you're trying to offload the neck and just give that feeling of stretching and reduction of tension in the spine and the back of the head. One of the other stretches that we can give, and these are just short examples, is when you're sitting in a chair, you hold onto the side of the chair and you lean away and tilt your head, and that stretches all the muscles in the side of your head, and you can really feel that if you want to try that. The other one that you can do is the same motion, holding on, and then look down at your armpit and lean away as well. So those are just some examples of stretches that we give in clinic. And again, like Dr. Bernard mentioned, these are just examples. Everyone is very unique and specific. So if you have any questions about your specific issues that you have, you would want to talk to your physical therapist, your chiropractor, your medical doctor, just to make sure it's appropriate for you. So one of the other exercises or stretches that we give, and this almost seems like an exercise, but really it's a stretch. So we call it a chin tuck, or we say you look like a chicken. So you pull your head straight back, kind of make a double chin and forward, and that stretches those tiny little ligaments in the back of your neck, and it helps put a position in your spine that if you do have a bulging disc, it kind of pulls that forward a little bit, so it reduces the pain and the tension. So those are some examples of the stretches that we use or give our patients, and again, everyone is unique and everybody has a different set of exercises. So another thing that we do is strengthening. So if you're sitting at a desk all day, you're generally leaning forward and you are reaching for your keyboard. So when that happens, the muscles in the front get very tight, so we generally stretch those. And then the muscles in the back, they get elongated, so they're pulled forward. And when a muscle is elongated for so long, they generally get weak, and we don't really use those muscles. So there are strengthening exercises that we use to help strengthen the back and pull those shoulder blades back naturally, so you don't have to feel like you're pulling them back all day. Your muscles are just strong enough to keep them back. So one of the exercises we give are rows, where you pull a TheraBand back and your elbows are down. Then we vary it up so your elbows are high, things like that. We work on core strength, so you can sit up tall and it's not a lot of work because your muscles are stronger and more, they have more endurance throughout the day. And then we also work on deep flexor muscles in the neck, which helps supports the head. So the head actually weighs about 8 pounds. So if you're leaning forward, that's 8 pounds of stress on your neck and your spine that you're putting on yourself all day long. And if you have better posture, it sits that head right on top of the spine, which reduces that pressure of leaning forward. So some other mobility exercises and examples that we give is your thoracic spine is directly correlated to the health of your neck. And neck and the mobility of your neck is directly correlated with headaches. So all of these things play into giving you headaches. So if we work on the mobility and the strength of the thoracic spine in a roundabout way, it helps reduce headaches and reduce that tension of the smaller muscle groups closer to the head, which cause headaches. So one of the things that we give people are thoracic rotation. So we want to make sure, so the thoracic spine is in the back, about this area of your body. So that portion of your spine, we want to get it to rotate in each segment. So we give exercises that help you rotate to get that mobility in your spine. Because whatever mobility you don't have in your thoracic spine, it's going to be made up for in the neck. And then there's a lot of wear and tear on the neck, and then you'll get a lot of tension, and then tension headaches come with that. Another issue that you can have is right at C1, so at the base of your skull, really close to your skull in that very first level. You can have a lot of tension in there, and it's really hard to stretch that. So sometimes we get our hands in there and we do some mobility of that C1, C2 area, and that can cause a lot of headaches if that's tight. So we teach you how to get more mobility in there, and then we also use our hands to give you more mobility in there. Another example is we do an example with a pillowcase. So we have you put it around your own neck, and then we teach you mobility. So putting the pillowcase behind your neck and holding it close to your chest, and then tipping back and rotating, just making sure each segment of your cervical spine is moving, and it's moving well, because that's imperative to cervical health and therefore tension headaches or not having tension headaches. We recently or briefly touched on manual treatment, so that means using our hands. So therapists use our hands a lot. We like to teach you how to take care of these things on your own, but we also know the importance and how helpful it is when we actually use our hands to manipulate your body in a position where it's going to be helpful for you. So we mobilize things and we help with reducing tension in the muscles. So one of the examples, and we mentioned it before too, is somebody will be laying on their back. We'll put our hands underneath their head, and we will just mobilize each segment of their cervical spine, which helps reduce tension and gives you that mobility that we talked about before. We also do soft tissue mobilization, meaning there's a muscle right on the side of your neck called your scalene that can cause a lot of issues, not only in your neck and your shoulder, but it also can help or promote headaches, like what we're talking about today. So we want that muscle to be nice and supple and not pulling on everything. So we'll use our hands and kind of strip that out and pull that in a good way so you don't have as much tension. And we already talked about the thoracic mobilization. So that is the thoracic spine in the middle. So instead of just the stretching, we'll get in there and we'll do gentle mobilizations of that spine so you have that mobility.